public speaking. In the job, imagine your next position, and also if you're public speaking, imagine the audience where you are. If you are in the bad health, imagine you are in a good health after medicine, and focus how strong you are. You even sometimes you don't know how you are strong. You are actually strong. Then imagine that and stop living with the negative thoughts. Always do the think positively, act positively, like that. In the face small fears every day. If you are afraid in the flying or work at height, face small, take small action to go away that. And also start questioning everything from yourself, from experts, like that. You will definitely have answers for that. Also support, and also educate yourself. If you are lacking in the leadership skills, try to improve. If you are lacking in public speaking, try to improve. If you are lacking in other skill, then try to improve. Educate yourself, because it is never ending now. Education is never ending. We have to all the ways unlearn things. Even today, I am learning from my lovely speakers today. Break the barriers. Then you can do it. Your effort will never tire. Thank you, moderator.
Thank you, Chaturani. So the key takeaways from your talk is, don't let fear control your life. You can control your fears, minimize your fears by regulating your emotions in relation to fear. And you also let us wrote down our 3 fears, and they have been categorized as the fear of the unknown and the fear of the known. I also empathize with Nasserin for fear of losing their hope in future as Afghan girls, since all of us know that it's already Taliban that control their country. The government of Taliban controlled them. So hopefully they have their future under their government to allow women, girls, to pursue what they want in their lives, to become successful and empowered. So thank you, Chaturani, that you have to also transform fear into action. Don't overthink it, but do something to visualize and try to do your mission as you want it. You have to face your fears rather than run away, and you have to face them. So encourage yourself by trying to learn new skills, trying to empower yourselves. Thank you, Chaturani. Thank you for your sharing. So we move on to Miss Jocelyn Kawira here, since so you have a problem earlier with your microphone. Can you now share? Please acknowledge, Kawira.
Yes, good evening.
Good evening, ma'am. So let me
Yes,
reintroduce yourself again. So Jocelyn Kawira is the Chief Executive Officer of Saita Academic Mentors, Kingsley, Kenya. Take it away.
One request, Jocelyn, please close the sound for your phone and let the sound only for laptop or vice versa, because there is echo. Perfect. Oh, no. Okay. Can we hear you? You are muted now.
good evening.
Perfect.
Yeah,
Good evening and welcome.
Okay, greetings from Kenya. Hello, can you hear me?
Yes, you may proceed.
Perfectly clear, please.
Yes.
Okay, so I was saying receive my greetings. I was not able to unmute, but now I was been able to unmute. Now, I want to talk about fear, and I want to thank my presenter who has done a very good job about fear. And I'll go direct then because she has already talked much about it. So I'll not dwell so much on definition because you have already been able to understand that. So I'll add something more on now the aspect of fear being something more about assumptions than the reality. We are told that fear is about fearing something that may come in the future. So it means one, it is not there, it has not yet started happening. And secondly, it's something to happen in future. So people fear things which are not even there. As our presenter has mentioned, you fear something which has not even occurred. And if you keep on that, it makes you perform poorly. We have been asked to present our fear for the year. And you see now people are talking of the fear in 2024 March, which is not yet there. So if you want to move on, you have to learn one, what is the opposite of fear? The opposite of fear is what we call, fear is phobia, and the opposite of fear is what we call philia, attraction. So if you want to move to those things you had planned, you need to now balance, because fear stops you from acting. Something you could have achieved, you start fearing, and then you stop doing it. So even your performance goes down. It is said that the most successful people are those who have learned the art of balancing phobia and philia. You fear something, and then you love another thing. Mostly we fear the thing we don't want to happen. And then we love that thing which we want it to happen. Balance between the two, you end up not moving on. So if you want to move on in life and handle fear effectively, I want to play a beam balance video, which we all of us know how a beam balance behaves. I hope I'll get it somewhere so that we can be able to use that to help us understand the aspect of fear and know how to balance it in life so that you're able to move on well. My beam balance, let me play it. Yes. I hope you can see my screen. as you have seen, the way I've played that beam balance, fear and phobia should balance in life so that you're able to move on to the next step and take the step to our destiny. Take the step to actually realize the potential in us. Because fear can put you so down and you'll miss to take a step to your next achievement. So you need to balance the two aspects. When you fear something so much, you miss in life. When you love something too much, it can make you act blindly. So you need to balance the two things. And we want to ask ourselves, in which areas of life would we need to balance so that we can be able to move on well? So I'll go back to my sharing, and I'll show you examples of where we learn to balance life so that we can be able to manage fear and still achieve something in life. One of the areas is in academics. I work with the student myself. As you can see, I'm just from class. So I'm doing my presentation before I go home from my car. Most students fear failing in school. Now that fear makes them not take any action. We normally say in psychology, fear to fail can make you not put any effort in your academics because you have too much fearing until you forget even to do anything in your academics. Another thing about fear is that it blocks memory. So in academics, you might find a student who should be performing so well, but fear has dragged them behind. They always are behind everything because of fear. Another area is in relationships or marriage. You find people who are struggling so much in a relationship because they fear that if they stop this relationship, something can be missing in their life. They have never known they can go out of a certain relationship and still make it in life. And that is why we've been having even people shooting each other in marriage because they feared separation. When things are not working, you should be on the other side of your life. You don't let fear, you don't let the beam balance side of fear go so down until you go into depression. You should be able to think, what can I do to get out of this situation? Some people will find that they fear if they left a marriage, the children will not get money for upkeep. Then this fear makes them stick in something that is not working, and then they end up dying into that relation, which is not healthy. So you should be learning to balance. Another area is in business investments. You find people cannot change what they are doing because they are fearing when they change, the whole thing will scramble. So they hold on a business that is not giving them profits just because they are fearing to change that business. And I can give lists of many things which can fail and make you a failure in life because of fear. So this evening, I would want to challenge ourselves to ask ourselves, where is not or what is not balancing in our lives? When the beam balance is not balanced, we end up missing a lot. So as our presenter there before has mentioned, take a stock of yourself. What is that which not working in your life? What is that you are fearing to let go? What is that dragging you behind because you have not balanced? And now change, ask yourself, what can I change? What can I put my mind into so that I can be able to move on? And the minute you do that, we shall be talking of no fear. Thank you so much.
Thank you, Miss Jocelyn Kawira. So you're inside your car. Hopefully, you're not stuck in traffic. And hopefully, you just open a little bit of your window to breathe in a balance between traffic and and speaking at the same time. I hope you didn't hit somebody while you're talking there.
No, my window is open.
You're open. So you lost your,
Yeah.
and hope you check out
My
your car
window is
because you might have lost
open.
your things. Okay,
Yes.
thank you. So,
And
Miss
it's
Jocelyn
quite
talk about
funny.
balance. Balance about
Yes.
there's always balancing in academics,
Mm.
marriage, and business investment. So, along with our first speaker, you always talk about taking stock of yourself, what I can do in response to whatever comes in life, whether in marriage, academics, and business. So, thank you, Miss Kiwara, for giving us a sense of balance in our discussion today. So, moving on to our third speaker, is Dr. Emmanuel Aquirana Ezekiel here.
No,
Kindly acknowledge.
he didn't. He is not here.
Okay, so we move on to our fourth speaker, Dr. Rizelina Calderon. Kindly open your camera. So, Dr. Rizelina Calderon is a Doctor of Humanities and Doctor of Education Leadership and Management. Is the founding directress of St. Mark Integrated School in the Philippines. She taught the high school, Manila Public Schools for 10 years, a bachelor in elementary and secondary education, cum laude graduate from Philippine Normal College. She took her master's in linguistics and graduate certificate in Precious Education, also from Philippine Normal College. She is a former stage director and actress, a scriptwriter who envisioned creating a school that has actualized her contribution, expertise, talent, and strategies in the academic together. She also happens to share my surname. So this is just a matter of sharing also life's joys, you know, ups and downs with her. That's why her name is Rizalina. It's always a risk coming into the marriage. I'm just joking. I might get an altercation later on. Okay, let us welcome Dr. Rizalina Calderon for her talk on titles. Take it away.
Hello, everyone. Good morning, good afternoon, and good evening, fellow educators and students. I'm Reza Calderon. Mabuhay. Thank you, Nolly Calderon, my hubby, for too long introduction. Now, let me see. What is stress? Hmm? Stress is the body reaction to harmful situation, whether they're real or perceived. When you feel threatened, a chemical reaction occurs in your body that allows you to act in a way to prevent injury. This reaction is known as fight or flight or the stress response. During the stress response, your heart rate increases. Breathing quickens, muscles tighten, and blood pressure rises. You've gotten ready to act. It is how you protect yourself. Stress means different things to different people. What causes stress in one person may be of little concern to another. Some people are better able to handle stress than others. And not all stress is bad. In small doses, stress can help you accomplish tasks and prevent you from getting hurt. For example, mhm, stress is what gets you to slam on the brakes to avoid hitting the car in front of you. That's a good thing. Our bodies are designed to handle small doses of stress, but we are not equipped to handle long term, chronic stress without ill consequences. Stressors are the external events, including pressures in people's lives, such as divorce, marriage, children, and work, and money pressures. The experience of stress, however, is related to how you respond to these stressors. Stress can be your friend or your foe. When stress fuels the spark of personal achievement, it can work to your benefit by making you more perceptive and productive, acting as a motivator, and even making you more creative. But when stress flames out of control, as it often does for many of us, it can take a terrible toll on your physical and emotional health, as well as your relationships. In today's fast paced world, women are experiencing more stress at every stage of their lives than ever before. Juggling job pressures, family schedules, money issues, career and educational advancement, and child and elder care concerns are only a few of the common stressors confronting women. Identifying stress. What does stress feel like? It often contributes to irritability, fear over work and frustrations. You may feel physically exhausted, worn out, and unable to cope. Stress is not always easy to recognize, but there are some ways to identify some signs that you might be experiencing too much pressure. Sometimes stress can come from an obvious resource, but sometimes even small daily stresses from work, school, family, and friends can take a toll on your mind and body. If you think stress might be affecting you, there are a few things you can watch for. Hmm. What are the symptoms of stress? Stress can affect all parts of our body, including emotions, behavior, thinking ability, and physical health. No parts of the body is immune. But because people handle stress differently, symptoms of stress can vary. Symptoms can be vague and may be the same as those caused by medical condition. So it is important to discuss them with your doctor. You may have any of the symptoms of stress. A stress management specialist can teach you some relaxation techniques, including deep breathing. When you're under stress, your breathing becomes shallow and rapid. Taking a deep breath is an effective technique for winding down. Inhale through your nose slowly and deeply to the count of 10. making sure your stomach and abdomen expand, but your chest does not rise. Exhale through your nose, also to the count of 10. Concentrate fully on the breathing and counting. Repeat 5 to 10 times. The goal is to take 3 inhales and 3 exhales per minute for a total of 3 deep breaths. Relax your muscles, sitting anywhere, even at your desk. Relax your shoulders. Let your arms drop to your side. Rest your hands on top of your thighs. Relax your legs. And don't forget your jaw muscle, which often tense with stress. Close your eyes and breathe deeply. You can also do this lying in bed, beginning with the top of your head and progressing muscles in your body. Then let it drop even more as you breathe slowly. Do the same with your shoulders, arms, and back. Visualization. Remember, like a relaxing time or place like a lakeside picnic or beautiful beach scene. Just close your eyes for a few minutes and picture it in your mind. Also, meditation. The goal of meditation is to quiet your mind, to relax your thoughts and increase your awareness. Meditation can also reduce your heart rate, blood pressure, adrenaline levels, and skin temperature. It involves concerning on a simple image or sounds while sitting in a comfortable position away from the distractions. It can involve cultivating an open awareness or a more loving attitude towards yourself and others. Meditation can also help you become more aware of your priorities so you can make more productive choices in your life. Massage therapy. This approach also the heart and relaxes the body rather than causing drowsiness. However, massage actually increase alertness. There's no specific test to diagnose stress. Typically, your healthcare professional conducts a variety of tests, which may include a personal and family health history, blood and urine tests, and other assessments to rule out various medical conditions. Because your symptoms may be similar to those depression, your healthcare professional should also evaluate your mental state to determine if you may be suffering from a depressive or anxiety disorder. So symptoms associated with stress, anxiety, and sleeplessness, for example, typically subside when the stress triggering them subsides. When these same symptoms are caused by depression or another mood disorder or fear or whatever, they may not go away without medication or therapy. If stress is identified as the culprit for the symptoms, you may want to ask your healthcare professional for stress management strategies and consider ways to control the stress source in your life. Before your health is affected, remember, reducing or eliminating the things that causes stress and changing how you react to it or the safest and most effective ways to treat stress. No single method of stress management is always successful. So you might want to try a variety of approaches. It's also important that you treat any medical symptoms stress exacerbates. However, keep in mind that treating the stress may not cure the medical problem. The causes of anxiety are not fully understood, nor are the reasons why anxiety affects some people to the point where interferes with their lives. A range of factors are thought to contribute to anxiety disorders. Most anxious people probably have genes that make them more likely to develop an anxiety disorder. Females are more likely to develop an anxiety disorder than males. Am I right? Risk factors for anxiety disorders include the following. First, family history. You are most likely to develop an anxiety disorders if you have family members with mental health conditions. Having another mental health disorder ongoing stressful situations such as problems at work, unstable housing, family or relationship breakdown, and grief, any kind of abuse such as physical, sexual, verbal, or domestic abuse. What else? Life threatening events, pregnancy and childbirth for the pregnant person or their partner, physical health issues such as thyroid problems and other chronic conditions or ongoing conditions, substance use, particularly cannabis, amphetamines, alcohols, and sedatives. Withdrawing from drugs and alcohol, having a certain personality type, such as being a perfectionist, having low self esteem, or needing to be in control. Everyone is different, and often a combination of factors contributes to developing an anxiety disorder. Hmm. Experiencing occasional anxiety is a normal part of life. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situation. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes or panic attacks. These feelings of anxiety and panic interfere with daily activities, are difficult to control, are out of proportion to the actual danger, and can last a long time. You may avoid places or situations to prevent these feelings. Symptoms may start during childhood or the teen years and continue into adulthood. In day to day, talking with our friends or family, we tend to speak of depression, stress, and anxiety as if they are interchangeable or describing the same thing. This is not the case. Part of the reason for coming to see a psychologist is to sort out whether any of these descriptions fit your experience. It is also important to remember that many people have elements of depression and anxiety and may not have full clinical diagnosis and may not require medication. D- Depression. Depression refers to an experience where you feel down most of the time, which is called low mood. And you have also lost interest in things you usually enjoy. You may also have changes in your sleep, appetite, feel guilty, demotivated, and generally withdraw from others. Stress is usually characterized by a sense of feeling overwhelmed. This feeling may be due to your coping capacity being overstretched or having been under pressure for too long. So some stress can help us to perform our day-to-day function. And too much stress leaves us distressed and often exhausted. Anxiety is a sense of fear or dread that something terrible is going to happen. Anxiety can be general or specific to a place, social situation, or thing. This we call phobia. How do you cope with anxiety? Enter, enter lifestyle measures. A healthy lifestyle can help you manage your anxiety disorder. Make sure you exercise regularly. Even a 10-minute short walk can help to improve how you feel. If you have not exercised in a long time, check with your doctor about what is safe for you. What else? Cut down on caffeines, which can increase anxiety and alter sleep patterns. And some people um, avoid tea, coffee, cola, energy drinks, and chocolate, especially after 6 p.m. Limit how much alcohol, cigarettes, and drugs you use. Make healthy eating choices. Get enough sleep. Some additional things you can do to help manage your anxiety include the following. Take time for yourself. Try to get involved in activities and pastimes you previously enjoyed, even if you don't feel like it to start with. Use relaxation techniques such as mindfulness and meditation. So, treatment options for anxiety disorders also include psychological therapy, medicines. Your doctor will talk with you about your treatment options and what may be best for your situation. They will consider the type of anxiety disorder you have, how severe your condition is, your treatment preferences. So, people involved in your care might include your doctor, a psychiatrist or psychologist, mental health nurse, or other type of counselor. So, treatment for anxiety and fear can take time. A good support network makes the process easier. Psychological therapy, anxiety may be treated by using different therapies, including cognitive behavior therapy. CBT is designed to change problematic thinking patterns that cause anxiety. Behavior therapy is a part of CBT that includes desensitization. Desensitization is a method of slowly exposing you to feared situations to reduce the anxiety that comes with them. Other types of therapy for anxiety may include interpersonal therapy, acceptance and commitment therapy, narrative therapy. What else? So, online support tools. Online tools may be suitable if you have mild to moderate anxiety. There is a range of different programs, most of which are backed up by phone, email, text, or web chat support from a mental health specialist. These online therapists can be particularly helpful if you're living in a rural and remote area. Access to health professional may be more difficult in these areas. Reachout.com has reviewed mobile applications and tools to help you look after your health and well-being. You can also find more information at Beyond Blue and the Black Dog Institute. Support groups through these organizations provide opportunities to talk with other people who have similar experiences. There are obstacles to females taking counseling, lack of time due to multi roles in family, work, and other fields. So, distrust on patient, confidentiality, and professionalism. The apparent stigma associated in attending sessions by the immediate family and friends. The additional cost to what is not tangible and necessity, practical, and the orange other concerns. So, meaningful change is not easy. It requires a cultural shift. 56% of depressed females fear losing respect, and 83% fear that people would view them as unfit. So we need to approach each other with empathy and understanding. We need to refer concerns to women help desk and resources. Also, noting that stigma and discrimination couldn't be addressed immediately, the health professionals are aiming for the patients to go to the center so that they will be properly treated. Because if they are just kept or locked up in their homes, they will never get well. Here in the Philippines, we also urge responsible media reporting on suicide cases, cautioning against the Werther effect, a phenomenon where sensational suicide reports in the media can lead to copycat suicides. For counselors, they emphasize the significance of asking with a willingness to listen when into depression and attempting suicide prevention. Here, stress the importance of helping individuals focus on the reasons for living rather than imposing reasons for them to stay alive. Being physically present for someone, even just a phone call away, can also make a difference. Go also encourage the public to inquire about previous suicide attempts, connect individuals to support groups or crisis contacts, and follow up regularly to ensure their well being. Educational coaching and consultation. We need an organization for learning, error analysis, task time management, reading rate, comprehension. What else? Board review, preparation, test taking, memorization, note taking, learning styles, test anxiety. uh, Disability appointments. Some are physically handicapped and because of their stress or anxiety. Putting up a call, email, online scheduling system with consultant are desirable. More info available on disability service website. Online sessions, the online system can be reached as previously stated. Additional information, if any, can be found on the internet of your respective countries. Counseling, test anxiety, personal concerns, relaxation techniques, biofeedback, stress management, what else? Adjustment. Women may schedule by phone, email, or the online appointment system. Level counselors to address additional mental health concerns. Learning resources for women and men alike. A library with books on meditation and tutoring. So, inclusion, disability, veterans, LGBTQ, what else? Health careers program. So faculty resources, exam, registry, disability services, handbook testing guidelines. What else? Make up exams, disability statement for syllabi, and what else? Accommodations and so vulnerabilities can be powerful. Serve as motivators, better equipped to care for others. What else? Increase empathy, enhance quality of patient interactions, more likely to attend to mental health concerns such as suicidal ideation among patients. To summarize, stress and anxiety are perfectly normal human reactions to threatening or worrying situations. They are part of the fight hmm, or flight response that keep us safe by preparing the body to deal with danger. Stress is the body reaction to a threat, whereas anxiety is the body reaction to the stress. People can manage their stress anxiety with relaxation techniques such as breathing, again, breathing exercise, physical activity, and talking about their worries. Sometimes stress and anxiety can overwhelm people. When this happens, it can lead to chronic stress or anxiety disorder. Anyone who finds stress or anxiety is interfering with their everyday life may wish to speak to a medical professional. So, my fellow educators, thank you so much for your listening. Thank you so much. Thank you.
Thank you, Dr. Salina. So since Dr. Ezekiel is not here, so let me summarize our today's sessions from our three speakers. From our first speaker, Ms. Chaturani, second speaker, Ms. Jocelyn, and Dr. Richelina, our third speaker. So I've I found out that all of our speakers, to put it simply, when we talk about stress, it could have been interchangeable with anxiety and fear. So let me take the liberty of having an acronym for stress. So stress, S is for self compassion. You have to love yourself. Start to love yourself. Accept your failures. And try to take stock of things where you can start and try to move forward, transform fear into action, as Miss Chaturani mentioned earlier. So T, so we're done with S. T is for time management. You have along with taking stock of yourself, you have to take time also. Not rush on things, but you have to look on yourself. What is the importance of what is for enjoying your life, exercise regularly, and as Doc Rizali mentioned about breathing exercises, I almost slept through the session, giving backwards 10, 9, 8 until 1. So your voice is quite hypnotic in that sense. So E is also for other than exercise, you have to educate yourself. You have to also empathize to those who are were having anxiety or having stress, having fears. Then S is for social connections. You have your family and friends to rely on. Hopefully, they support you. So S is also for support from health professionals. So we can give therapy, counseling, and up to the point of medications if needed. So as Speaker Jocelyn said, you have to find balance in our lives. To have balance between phobia and philia, between fear and love. So that's why we start from ourselves and start loving ourselves, and also try to understand those who are under stress, under society, and help and support them in their fight, in their fight and in their skills to be empowered women in our society. Thank you, everyone. So for our our closing remarks from our founder, Sir Moidin. So while waiting for Sir Moidin, so so I'm also one of Ma'am Marisa's stressor. So don't say it aloud, though I already announced it to the world. So our next webinar is to just tune into our social media, internet, global education network for our next sessions. There are so many sessions scheduled, so you just have to once in a while check our social media, especially at Facebook, our global education network sessions in the future. Dear Corina, is Sir Moidin here? Okay. Okay, so to top it off, this is actually a fruitful session, and thanks to our speakers here. It's well done, and thank you also to our worldwide audience who has been with us, even though it's late at night, at almost midnight here in the Philippines. Thank you, dear Chaturani. Thank you. Thank you, Miss Jocelyn. Thank you, Ma'am Risa. And for our final pictures, can we have our audience open their cameras for our photo op for our documentation? Kindly open your cameras, please, so we can have our pictures taken. So I'm going to take the pictures as well. Smile, everyone. Smile. Face your fears. So face yourself in the mirror and face your fears. Yes. But before you face the mirror, be sure to comb your hair. So well done, everyone. Thank you for your time. I'm Miss Jocelyn. Okay, so next time when you're asked, I heard Ma'am Risa earlier said, so avoid being hitting somebody on the road. So if you're given a choice, you're driving a car, will you hit a kid or an old man crossing the street? If given a chance, this dilemma, which one will you
No,
hit? The child or the old man?
None.
None? Really?
Yes.
You will hit somebody else if you don't hit the brake. Yeah,
Um,
hit the brake.
excuse me, Sir Nolly.
Yes.
Someone is asking what is PTSD, PTSD, or if it is a treatment. So, PTSD is
Post-traumatic
post-traumatic stress
stress.
disorder. So it is a
Ah,
disorder that develops in some people who have experienced shocking, what else? Scary
traumatic.
or dangerous event. Mr. Who's asking? Mr. Saba is Hawk. So that is a disorder. PTSD is a disorder. It's not a treatment. Okay? So thank you so much. Miss Karina, thank you so much.
If there are no more questions to our okay, so we will also allow our audience to fill your questions to the chat. Okay, thank you for your time, Karina. So with the permission of Karina and Moidin, we will close this session. And until the next session, goodbye, everyone. I'm Dr. Noli
Bye.
Calderon, your moderator for this session, and good night.
Good night.
Good
Thank
night.
you.
Okay.